From KETK, you're watching East Texas Live.
Welcome back. It's Medical Monday, and joining me now is Dr. Joseph Conflitti, and he's here to talk about robotic-assisted total hip and total knee replacement. How are you doing today?
Doing great. Thanks for having me.
Yes, sir. So, what exactly is robotic-assisted joint replacement, and how does it kind of work for our hips and knees?
Absolutely. So, first, I want to just kind of show you here as the diagram of a total knee. That's kind of what it is. We're resurfacing the end of the bone of both femur and tibia, and likewise on a hip replacement, similar concept that we're putting in a new ball and a new socket. But what we've added to that is the addition of robotic surgery to help improve the accuracy of the cuts. So traditionally, it was just done by hand, and cars aren't made by hand anymore, done robotically for accuracy and precision. So that's what we're able to do. We get a CT scan, and that CT scan then maps out everybody's individual anatomy, and then we can put it in very, very precisely.
Yes, sir. And how does using this robotic assistance kind of improve the precision and outcomes for the patients?
Very, very good question. Before, if we just putting in by hand, the ligaments weren't quite right. There was a little bit of laxity to it, or not so secure. But now that we can individualize it, it makes the range of motion very, very nice. And in doing so, then the patient feels better, feels more like a normal joint, and get back to activities a lot quicker.
Yes, sir. Who do you think would be a good candidate for this?
So really anybody who has knee pain, of course elderly folks or older patients who have arthritis, typically then we would talk to them about surgery. First, we always want to do conservative management, but when it comes down to it and it's ready for this, definitely having that robotic assistance is an improvement from before.
Sir. And so what's the recovery process kind of like compared to traditional joint replacements?
Yes, so by making it so precise, so the ligaments are all balanced, or in a hip replacement, we can make sure it's in that functional plane of motion, the patients will notice a much quicker return. So same day they're up and moving, go home the same day from the hospital, and then the therapy process is so much easier. The range of motion is improved, and in doing so, then we can get them back to their function.
Yes, sir. And so why is it important to offer this kind of technology here in East Texas, and how does this benefit our community?
It's a great, great thing to have. We've had it now since 2016, and it's just improving every single year with technology and the software. But to have it here means we can take care of our patients here. They don't have to go to Dallas, they don't have to go to Houston. They can recover here in their own home, in therapy, in the community. So don't have to go to the big city, we can do everything here.
Yeah, so that's awesome that we can do that right here in East Texas. So if someone is experiencing hip or knee pain, when should they consider seeing an orthopedic specialist like yourself?
Yes, so anytime there's pain in the hip or knee joint, you really want to get in sooner than later, because we do have a lot of things we can help other than surgery, which may be injections or therapy, weight loss, different aids to help with that. But when it comes down to it, when that all fails, then we can offer this for them to help improve. And what we really want to do is get that patient back to their life. We want to get them back to their function and what they enjoy. So if we can offer that here, they don't have to have a big trip to a big city, we can do that.
Yes, sir. And why is it important to, go seek help right away instead of letting it sit for a while?
It's really critical, because the sooner that we can catch it, we may be able to delay a little bit of the progression. If we can help with the therapy in terms of stability and the muscle strength, perhaps allow that patient to continue with activities. And it makes the surgery a lot easier too. If there's a significant deformity or a leg length problem, it makes it harder to recover from. So we want to catch that early as we can.
And where can people get more information?
UT Health website be a great place. Definitely there's a lot of information. We have a lot of videos, shows procedures, shows kind of what we do ahead of time and with conservative management, and then the surgery itself.
All right, well, thank you so much for coming in.
Absolutely, thank you for having me, I appreciate it.
Yes, sir. For more information, go to the website right there on your screen.